My name is Vickie Ramirez, and I am based out of the University of Washington Center for One Health Research. And I also support the One Health Clinic based out of Seattle. And I am your moderator today. You have joined this meeting today. It's called Workshop, Building a One Health Clinic Collaborative for Human and Animal Well-Being. This workshop is designed to provide a brief background to the One Health Clinic concept, and then to workshop how to create a One Health clinic in your community. The speakers from the New York City have been chosen since they recently took steps to start a One Health clinic, which piloted in January of this year. I'm going to do a quick introduction of the New York City One Health Clinic team. This team is based out of Breaking Ground. Breaking Ground's mission is to strengthen individuals, families, and communities by developing and sustaining exceptional, supportive, and affordable housing and New Yorkers. Units of permanent, supportive, and affordable housing, and approximately 500 being across New York City. Also provide 24/7 street homeless outreach of New York City to help people today. So first we have John Betts, Assistant Vice President of Program Development and Innovation and John is a social worker by training and is now in his first year of PhD. He's a PhD student at the New School studying homelessness and housing. We have Alejandra Magaña, a program director of Breaking Ground's Street to Home Queens Outreach Program. And Alex is a licensed social worker, and one of her goals is to complete the Veterinary Social Work Certificate program and combine her passion for animals and social work. And then finally, from Breaking Ground, we have Jill Maddox, who also is working with Janian Medical Care, an affiliate of the Center for Urban Community Services, and is medical director at Breaking Ground, as well as medical director for the Project for Psychiatric Outreach to the Homeless. In addition to working in homeless psychiatry for 13 years, Jill spent 3 years as a mobile crisis team director at Kings County Hospital in Brooklyn. And then finally, we have Dr. Katie Kuehl from the One Health Clinic leadership team. She's the director of veterinary medicine at the One Health Clinic in Seattle. Katie is a veterinarian and assistant professor for Washington State University's College of Veterinary Medicine. And she is also the director of the WSU Shelter Medicine program based at Seattle Humane. She supports sites across the country looking to replicate the One Health Clinic model. So thank you all for joining us, and I apologize again for my unstable Wi-Fi, and looking forward to working with you all to start One Health clinics in your communities.
Great, so I will pick up from here. Thank you, Vickie, and provide a brief overview of the learning objectives that we're going to go through today that Vickie alluded to, and as well as an agenda of the session. And then I will hand it over to Katie to get us started. So as Vickie alluded to, we're going to talk a little bit about the One Health Clinic model as a model of integrated human and animal healthcare. We're going to talk a little bit about the One Health Clinic pilot that Breaking Ground and Janian did in January. And then we're going to leave you all with hopefully some concrete next steps in terms of potentially setting up One Health clinics in your community. So the learning objectives for today are being able to describe a One Health clinic model, explaining how One Health clinic can reduce barriers to healthcare and housing, key considerations in designing and developing a One Health clinic in your community, and then, as we said, leaving you with some tangible next steps of knowing where to get support to potentially start a One Health clinic in your community. With that, I'm going to turn it over to Dr. Kuehl to talk a little bit about the One Health model.
Thank you so much, John, and really thank you all for being here. Sorry about all the technical difficulties, but I wanted to start off with a little story. And so the story is about the folks that you're seeing here. This young person presented to our clinic seeking evaluation for their sweet little ferret companion. And it turned out this little weasel was feeling under the weather. He was showing some decreased energy, nasal discharge, some sneezing, and we determined that this little friend was suffering from an influenza virus. We started to educate the owner about how humans and ferrets can actually have some diseases in common, like influenza. And at that time, the owner revealed to us that they were actually experiencing similar symptoms. We were able to get them connected with our nurse practitioner to be evaluated and get care for themselves, all in that same visit. And so, you know, if you think about that in either a regular human clinic or a regular animal clinic, it's pretty likely that the connection between these two would have been missed entirely. And only one side of this partnership would have been provided with care. And so it's with this integrated care model that we use at the One Health Clinic that we were able to get both this person and their little ferret friend set on the road to recovery in a single clinic visit, breaking down barriers to care for both of them. So with the goal of the clinic model being to integrate veterinary human care, you know, we create these combined healthcare plans. And when clients visit the clinic, they don't have to visit with the human healthcare provider, but they do at least have to say hello. And we find that even folks who initially decline care with the human healthcare provider actually end up engaging in full appointments after we sort of break the ice during the veterinary visit and create connections with folks. In our first year running the One Health Clinic, our human healthcare provider, Neighbor Care Health, saw a patient load increase of about 32% after adding the veterinary care to the existing clinic. But in addition to that, they actually also saw an 18% increase in patients returning for follow-up care, even on clinic days when the veterinary clinic wasn't being offered. So we felt like we were moving in the right direction with this integrated care model. And so I know everybody here in the audience already understands and experiences every day the importance and the power of the human-animal bond, as well as the spectrum of the interactions that both benefit and the challenges that can come from a result of this bond. This photo actually came out of a project that captured storytelling from our community here in Seattle of persons experiencing houselessness with animals. The SEAM project was part of the formative work that guided the formation of our clinic. And I'm sure it will come as no surprise to all of you that in this work, we confirmed that people will choose to seek care for their animals before accessing care for themselves, and they may refuse services for themselves if their animals are not welcome to join them. If you're interested in looking closer at this formative work, the article is linked in the Whova app with our documents, and you can definitely explore that more, as well as checking out the website here on the slide. You can explore more of the stories of these families from this project. And so just real quick before I hand it back over to John, I wanted to talk a little bit about just like the different types of clinic models that can exist under sort of an umbrella term of One Health and kind of differentiate that from what we're kind of talking about here today. Because I think a lot of people have realize that this is a great idea and there's different ways of kind of going about it. Obviously, traditionally, you know, single care models where we've got human health and animal health separated, you can focus on each individual, but you don't have that human animal interaction like we talked about at the beginning. With referral care models, so folks are setting up clinics where maybe we have veterinary services being offered, and then we'll bring in somebody from the human health or services side to sort of be available to talk to people about different resources that are available. They might be able to set up referrals for appointments at different clinics. But as I'm sure you've all experienced, the barrier to that is the follow through. You know, you can set up an appointment at a different clinic, but that doesn't mean that the person is going to be able to get the transportation to get there, get off work to get there, have somewhere for the animal to be so that they can go to their clinic if that clinic is not going to be welcoming of their animal companions. So that's, so there is some extra support there, but it isn't really integrating the care. And then when we get that side-by-side model, we can start offering our services in the same location. So we can have human care, we can have the veterinary care in the same place at the same time. But depending on the organizations that are providing the care, the services may still remain siloed. And so, you know, there may not be that communication that's happening between human and animal care to create, to recognize where there can be shared health risks and shared environmental concerns, shared concerns with care. So in the One Health Clinic model, really what sets that apart is that we're communicating, we are integrating our plans, we are tackling the challenges for both the human and animal together at the same time. And really the biggest drawback is that this is never going to be a numbers generator, because this is the kind of thing that is going to take some time and effort. And in order to provide that integrated high quality of care, we need to take our time with both the veterinary and human visits. So, all right, moving. Oh, and I've got one more slide. So, after we started piloting this clinic and our healthcare partners and us, we decided like, wow, this is really working really well. People are our community is really receptive to this. We wanted to see if we could bring this integrated care to other communities. So we created this free toolkit trying to engage with other like-minded professionals who are interested in starting these clinics in their communities. And that's kind of where this story begins. I'm going to hand this off to John to talk about their journey.
Yeah, thank you so much. So as Vickie said at the start, Alex and I both work for Breaking Ground, and Dr. Maddox is our medical director for Breaking Ground and is also employed with Janian Medical Care that's affiliated with Center for Urban Community Services. So Breaking Ground is a large social service provider and supportive and affordable housing developer in New York City. We also provide transitional housing and provide 24/7 street homeless outreach to folks currently experiencing homelessness in New York City across the majority of the geography of New York City. So last spring, Alex and I attended the National Healthcare for the Homeless Council Conference in Seattle, and Vickie and Katie were there and gave a presentation about the work that they were doing at the Seattle One Health Clinic as part of that conference. Alex and I happened to attend that breakout session. Both of us are big animal lovers. And Alex is going to speak more about this here in a little bit, but we also both knew that there was a sizable number of folks who were experiencing homelessness on the street, who were resistant to entering shelter because of restrictions around their animals. So Alex and I were both very inspired by the session that we saw at this at the National Healthcare for the Homeless Council Conference, returned to New York, returned to the organization, and started doing some thinking about how we could potentially integrate this work into the work that we're doing on the day-to-day. So we started by taking a sort of informal survey of the client population that we serve. So last summer, we did an informal survey of our street homeless outreach programs, as well as our transitional housing programs. And across Breaking Ground's transitional housing and homeless outreach programs, we found that there were approximately 19 dogs, 5 cats, and 1 snake at the time. The snake and its person have since moved into permanent housing, but that were receiving services from Breaking Ground. We also were not aware of, while there are sort of free resources for folks to get care for their animals in New York City, all of them tend to operate in a very siloed way, in the way that Katie talked about, that it's very much sort of the outreach team or the case manager at the transitional housing making a referral to the free clinic at the ASPCA, and there's no sort of loop closure or sort of integration of that care. And so we were hopeful that this One Health Clinic would sort of help us solve some of that care integration issue. We naturally turn to Janian Medical Care. So Janian is a medical practice that provides services across all of Breaking Ground's programs, as well as numerous other programs in New York City, and specifically focuses on folks who have previously experienced homelessness, are currently experiencing homelessness, or are otherwise have very complex health and psychiatric needs. And so Janian was a natural partner in attempting to integrate the healthcare into the work that we that we wanted to do through the veterinary care because they are already providing medical and psychiatric care across our service portfolio. So Jill and I had a conversation, and Jill was on board and knew the importance of the human-animal bond as a sort of determining factor about whether or not someone will be open to additional services and potentially coming inside. So we began having conversations about where to have the clinic, particularly around logistics, location, transporting the animals. And there were also some issues that we had to work out regarding we don't usually have veterinary service providers on site, and the Janian medical providers don't normally have animals in their medical spaces. So we had to address some issues and work through some questions around those, which we were able to do, including some legal and insurance things. Ultimately, we were able to achieve this by treating the vets as volunteers that were coming in to provide a service, and the clients were already signing treatment consent to receive treatment from the vets that were on site. And so we were able to address all of those needs in that way. We also already have information sharing arrangements with Janian in the day-to-day work we do with and for our clients. And so we were able to share information in that way already through an established protocol with Janian. So we knew we wanted to provide this One Health clinic, taking a step back for a second. And so I reached out to Vickie and was actually connected to this toolkit, which we began to use to help us begin to plan the One Health clinic. Vickie connected us to the Street Dog Coalition team, and we were connected to these two vets, Dr. Biana Tamimi and Dr. Justin Lamb, and Dr. Justin Lamb in New York City. And they were the vets that came on site for the day and offered the veterinary care to the folks who brought their animals in to receive care. All told, we served 6 households with 7 animals that day. And everyone was very, very excited. We treated it as a sort of pilot and are hoping to do it again in the future and integrate some lessons learned from that day. And I think Jill is going to talk a little bit about that. And so I'm going to hand it over to her to talk specifically about sort of the medical side of the veterinary human medical perspective.
Thanks, John. I was extremely excited to hear about this model of care because at Janian, what we do is homeless health care, and we do it on site in programs. So many of those barriers to healthcare that we alluded to earlier, we get past by just being in the same space where our clients are seeking other services or housing. However, there are still lots of barriers to people wanting to come and see a primary care provider or a psychiatrist. And I think a lot of those are internal barriers for the client, and working in conjunction with the vets in the One Health clinic, I saw great opportunities to overcome those barriers. And not just because the model says you have to engage with a human health provider in order to get the vet care, but also because of that value of the pet-human bond. So I wanted to talk a little bit about 2 closely related internal barriers that I think are really uniquely addressed by this model. Those are the shame that our clients are very prone to feeling and the history of trauma that so many of our clients are carrying around, the sequelae of that. So, meeting with the doctor and especially a psychiatric provider, it does bring up feelings of shame, unfortunately, in a lot of our clients. When you do a psych eval, you have to kind of give a litany and the history of all of the problems that you've had in life. And that's hard to do and kind of activates people's shame often. We ask about drug use, incarceration, hospitalizations, your failure to work, your failure in relationship. We go into all of that, and that's hard. And the whole time also you're sitting with someone with an inherent power differential and thinking that, oh, this psychiatrist probably did everything right and, has a perfect life. And it's tough. And if the only thing people are feeling during that session is shame, then they're not going to come back and ever meet with a mental health professional again, because it just feels awful. They leave with worse mental health than they arrived in. So I think being able to start the engagement with, a pet owner who is bringing their pet for care just provides this beautiful opportunity to really talk about a thing that the client is doing really well at, caring for their animal and bringing their animal for care. And starting off that way, I think it just brings up so many good feelings in people. It really helps overcome those feelings of shame. And similarly, a disproportionate number of our clients do have a history of abuse and neglect in childhood, and certainly have experienced trauma while homeless, which leads to often a lack of trust in the good intentions of anyone who says that they're going to help them, right? So this can sustain homelessness and also lead to people not getting care for themselves, whether it's primary care or mental health care, because they just naturally have doubts about, whether someone's going to take good care of them or just sort of use them, or even worse, abuse them. On top of that, many people that we see in the single homeless adult system is that a lot of people have lost custody of their children or have lost relationships with their children, which is traumatic and often becomes really a deep source of shame. However, those who have pets, I think, and we all know this is part of the value of pets, when a person can experience the bond between a pet and themselves. It really shows them that they can love somebody else, they can care for somebody else, that those things are possible in them and therefore in other people, and can really kind of open them up to possibilities of having better relationships and really getting help with some of their problems in the future.
Thanks, Jill. And I think that segues really nicely into not only the importance of the human-animal bond in seeking care, but the way in which it also intersects with housing. And so Alex is going to talk a little bit about that.
Yeah, thanks, John. So this is just a snapshot of where we held our One Health clinic. I think Breaking Ground, we're very privileged in that we had a lot of locations to choose from. So we were to pick a site that was going to be really, that was going to just be able to be a good fit, logistically speaking. But yeah, one of the things that, as our outreach teams experience, I think we experience a lot of engagements with clients that already have a lot of barriers to housing. And when we engage our clients that have pets, the first thing that comes up is, I'm not willing to be separated from my pet. I want to be housed with them. And so we work off a housing first model. So we want to remove all of these barriers from our clients. So, having this One Health clinic where we're able to take our clients that we're engaging on the street, bring them into the clinic, where not only are they seeing the veterinarian to get the shots for the pets, if needed, an ESA letter, but the client is also able to meet with medical or psych, was really helpful. And I think a lot of our clients, they, are very proud of their pets, and when we engage them on the street, they might have some reservations, like declining services, but what we find, engaging them, with acknowledging the pet first is like such a good segue into opening up their trust building and really building that relationship with the client. And, I bring that up in engagement that we had with the client who had been homeless for a little over 10 years. And this was before we had expanded more on our ESA policies at Breaking Ground and within the city. But, this individual client was homeless for 10 years, He had been routinely engaged by us, but was always declining housing services because at that time there was just no way to get his pet in with him. So, you know, one day when things started changing, we engaged him on the street. You know, his dog was beautiful. And, you know, we started the conversation by like, oh, it's such a pretty dog, beautiful, really calm. And he just opened up completely because we initiated that conversation talking about the dog. And afterwards we talked about, you know, the steps we needed to do in order to bring him and the client in. And his first question was like, if my dog Sweetie can come in, I will come in. It's like, sure, we got this. And, you know, at the time it was, you know, like what John mentioned earlier, we had to set an appointment with the ASPCA, which took about a month and a half. So that meant that client had to like stay on the street for a month and a half until we had this appointment. But once we did, within 2 days, we were able to find a placement for this client. Client went into housing. He was there for about 8 months while we worked on a housing packet, and now he's permanently placed with his pet Sweetie. So it really just shows the importance of like being able to remove the barrier of, you know, pets being a barrier for clients and bringing them in and offering housing, and how quick our clients are to accept that. And I will say at the One Health Clinic, when we're doing the intake forms, you know, our individuals that we were engaging, they were just the most talkative they ever are, because, you know, we're talking about their pets and they're telling us about their personality. And as social workers, it's a really good way for us to segue into the conversations that we want to have clinically, you know, with the clients. So but overall, housing is such an important factor. And I will say all the clients that we've connected with that were able to, you know, get their vaccines that they needed to. And once we got them into housing, they've stayed in housing and have not returned to the street because, again, their main barrier was they didn't want to be separated from their pet.
So I think what we had intended to do is if there is someone who would be from the human health field, someone who's attending this session from the human health side, would be willing to share what city they're coming from, that Dr. Kuehl would, maybe we can spend about 5 or 7 minutes talking about how to connect with veterinary care. And then we can have a animal health side do it for the next 7 minutes, so that you know how you can connect with organizations who may be able to work with you to create a One Health clinic in your community. Is there anyone who'd be willing to volunteer their city from the human health services or human services side or healthcare side?
Maybe I can help with this because I'm actually a person with lived experience. I want to start a nonprofit to help people who are caring for colonies of community cats. I see these people that, you know, they're poor, vulnerable, marginalized, elderly, disabled, have mental health issues. They often go without food, they go without other necessities because they want to care for these cats. So I'm in a situation where I'm kind of in the middle here. I volunteer with human services, but I don't really know any human, the health, I don't know how to access doctors. I don't know how to access vets.
Oh, okay.
So I'm kind of, you know, I'm in the middle here. I need help from both sides.
Human health folks, do you want to speak a bit about how someone in York, Pennsylvania could access human health services?
I was going to just point out a couple of resources, and then I'm sure Jill has other thoughts as well. I can share my screen here. So the first is the National Healthcare for the Homeless Council. So if you go to the National Healthcare for the Homeless Council website and look at their grantee directory, this has a list of all of the homeless healthcare, which is a particular type of federal grant. This has all of the grantees across the country listed, and you can find the one that's closest to you, and there should be contact information for that entity. What part of Pennsylvania is York City in?
We are in the southern part of it. southeastern.
Okay, this is Southwest, but it will give you an example. So this provides contact information for that organization that would be potentially a place to start to reach out for information about the human healthcare side of things. The other, not necessarily healthcare provider, but oftentimes they will have a connection to a healthcare provider, is just the general human services entity that provides homeless services in your area. And you can find that list through the National Coalition for the Homeless. They have a national directory of resources and shelters, as well as some specific, more localized lists. And then I think, Jill, you can talk about the mechanics of sort of who to ask for and how to talk about it.
Sure. I think often like a clinic director, a clinical director, maybe a medical director, or a social work director or supervisor, that type of person might be able to maybe direct you to other resources if they don't want to get involved themselves, or direct you to, you know, the right person to talk to at that institution. I think sometimes what it takes is like someone like John and Alex, who just are animal lovers and sort of like see the value of this. And so I think if the first person you talk to is kind of like, no, we don't do that, you know, you're kind of looking to poke around and try other folks and see if there's somebody who hears this idea and like lights up like I did about this, and then start working on the logistics.
Great. Katie, are you able to pull up the vet side?
Yeah, let me go ahead and share my screen here. Didn't want to steal it from John too early.
Well, while she's doing that, I'll just say one more thing of finding a person that may light up about it. Any animal nonprofit in the area as a 501c3 will have to have a board of directors. Oftentimes those boards of directors that sit on those nonprofit boards are people who are well connected in various communities who may not directly be involved in the medical profession, but may be. And so that could also be another potential in of finding the person, like Jill said, that sort of lights up about it. Go ahead, Katie.
Yeah, thanks. So this is this map is available from the Street Dog Coalition, and that's one of our partners in this project. They are working on integrating One Health Care into different clinics that they're involved with, but they basically are doing something similar with the veterinary side of things, where they're mentoring clinics in places all across the country. So people who are interested in providing this kind of care get connected with them and then get supported with access to subsidized consumable supplies, vaccines, that kind of thing, and marketing. And so if you look at this map, I can see a couple of locations for sure that are, I mean, there's lots of locations on the East Coast, definitely. And so this is one option to start with as you're sort of kind of looking in your own community to see what might already be happening in the veterinary care realm or who you could connect with. And certainly you could reach out to Street Dog to let them know, hey, if you do have somebody who's interested, I want to get connected with them. They're just a great resource in general if you haven't connected with them before. Some other ideas that I have for
Katie,
yeah.
do you mind if I interrupt quickly?
Yeah, go ahead.
Street Dog Coalition is also open to starting new teams in new cities.
Yes.
So if you do not happen to see a Street Dog Coalition team in your city, if there is a veterinarian who is interested in leading a group, they can reach out to Street Dog Coalition to become team leads. What Street Dog Coalition does is they provide basically all the vaccines and all of the consumables needed to run veterinary clinics, street like medicine, street veterinary clinics. And so there is no cost except the volunteer time to running a clinic, since Street Dog completely supports everyone on the back end. So so I just wanted to put it in there that you can start your own team in a city.
Yeah, thank you, Vickie. And I want to touch on two other like big options for connecting with veterinarians who might be involved with or interested in this work as well. The first is figuring out who your local animal welfare organizations are. So are there already folks who are providing some services to feral or free roaming cats, or supporting these colonies of cats and the folks taking care of them? Could be a spay neuter clinic, or other access to care type clinic. And depending on the laws around feral cats where you are, that might be something that your local governmental, like nonprofit animal welfare, or even private nonprofit animal welfare group might be providing some care or support in. And that's just generally across the board. If you are interested in this type of work, that's going to be a good organization to connect with. And then the last is looking to see if you have anything going on in your community, in your region, with veterinary medical education. And that could be a veterinary college. There's not as many of those, but it could also be a veterinary technical program. So for a program for licensed veterinary technicians or veterinary assistants, there's lots of different private and public institutions that offer those programs and employ veterinarians, and then do look for ways to get their students involved in practicing their clinical skills, but then also providing care to the community. So that's another important connection that can be made.
Awesome.
Are we going to move on to another question? Or?
Well, there's Genevieve has her hand raised. I'm sorry, has their hand raised.
Okay.
Yes, thank you. I just wanted to remind people that Feeding Pets of the Homeless, we're a national organization, and we work in partnership with Street Dog. So when Street Dog or any of the providers, whether they're shelters, domestic violence, social workers, if they have an animal, their client has an animal that's injured or ill, they can call our offices headquartered in Carson City, Nevada, where we will set them up with an appointment at a local veterinary hospital. Right now, we have over almost 1,600 hospitals across the country that we work with. And if we don't have one in that community where that homeless and that injured pet is located, we will find one. We pay at time of service. There's no cost to the homeless. We do verify homelessness, though, because we were scammed so much. We've been doing this for 15 years, and we have treated in our emergency program almost 6,000 pets.
Great. That's awesome. Valley has their hand raised.
Hi, I'm actually from Winnipeg, Canada, and I used to work at the Winnipeg Humane Society here, and we planned One Health clinics in local community centers in low-income neighborhoods predominantly. And one that we did that was really successful was we have a doctor here who's like the rabies vet, but he's also a human medical doctor. He's clearly an overachiever, but he came and did, a bunch of vaccines. So COVID vaccines, flu shots, stuff like that. Also, we brought in hairdressers, which was a really big hit. Everyone went to the hairdresser. So moving kind of beyond just like medical, like human medical practitioners, like just thinking about hairdressers. We also had pet groomers, veterinarians as well, techs. We have a vet tech college here as well that we can lean on to. And, I think that it can go much more beyond, like One Health is can encompass so much. And I think there's so many aspects to health for both animals and humans. So thinking a bit outside of the box too can be really helpful for folks. And one organization that I like to point to up here in Canada is called Community Veterinary Outreach. And they will bring in like the dentists, dental school, folks from the dental school or dentists who will come in. They'll have people talk about diabetes, smoking cessation, just a whole bunch of different things. And I think that really leaning on those community associations can really create those connections as well. So we were also hoping to do a lot of One Health clinics up in northern remote communities where they don't actually have dentists and available resources. So having those folks go up to remote communities like dentists at the same time as the veterinarians can really bridge those practitioners. So yeah, and I'm available to chat as well if anyone has any other questions.
I know that Judy Ray has her hand up.
Hi, Vickie. Nice to see all of you. Just a question here from Kitsap County, Washington. We are super excited about our co-sheltering project beginning here with a renovated building. What you said earlier was that One Health offers facilities, vaccinations and medical supplies, things like that. However, there does need to be a veterinarian on site or someone to complete the certifications, correct? To administer it and to complete all the paperwork.
Katie, I will probably leave that question to you. The folks that fund the vaccines and all the consumables, it has to be under a veterinary care team. It wouldn't just be distributed to the shelter.
Yeah, there has to be a veterinarian of record for the Street Dog Coalition. I think that's what you're talking about. But in general, anytime you're providing veterinary care that's under something that's classified under your state's Veterinary Practice Act, there does have to be a vet of record supervising the event. Certainly if you were offering things like toenail trims or grooming or care supplies or things like that, you wouldn't need a veterinarian necessarily for that type of care. But for any medical care that's under your state's Veterinary Practice Act, you need a veterinarian overseeing that.
Awesome. We've definitely rolled into the Q&A section. There are some questions in the chat, but I did want to ask Jill, because this is a question that comes up with the integrated care model. So it's not the healthcare is in one location and the animal care is in another location and the vet team and the human teams aren't in communication. In a One Health clinic where they're in communication, Jill, how did you address the questions that came up to you about how do we make it hygienic to bring animals into your clinic? Or weren't you concerned about animals bringing in diseases into the human health clinic as you guys integrate the care? What would be your response?
Yeah, that was one of the first questions I had going back to my agency is, we do this thing, and if somebody wants to go into the exam room with the provider, can they bring their animal? And the answer was, yeah, no problem. I think, the medical spaces are designed to be easy to clean and to, they're not sterile environment, but be able to kill any germs that get in there. Because people carry diseases too, like animals. So I think that it might be an unfounded fear. All of our spaces are built to regulation and we have to follow, and we're very vigilant about following all the rules of, our state licensing and our managed care. We don't bill Medicaid or managed care for any of our homeless clients, but we do for those who are in housing. So we have to, in all of our spaces, we have to adhere to all of their standards. And I kind of anticipated, is there going to be pushback about bringing animals into the spaces? And And there wasn't. And I was told, like, no, we'll just, we'll clean it down just like we do between every patient. We'll take care of the space.
Great. That is a question that comes up for us a lot. A question for Alex, because we are integrating the human and veterinary care, what do you think that your role as a social worker brings to that One Health clinical care model?
I think what we bring is, right, like we're often point, it's when you're talking about outreach, we're the first people that the client is engaging, right? So we're building that trust, and then we're doing that handoff, right, when we're doing the intake. And I think specifically one of the things that we did with this intake, we had two different ones, right? One for the pet, one for the human. And we were very careful in doing the pet one first. And I think as social workers, we're really good at opening up the conversation, right? We notice that a client said this and be like, oh, let's use our clinical skills to like look at this and, put that in our reporting. But, we're also able to, give skills to the client, right? Where like a pet is a protective factor for the client, right? Like they're on the street and it's such a protective factor for them. So like we can bring that, and like, again, as we were mentioning earlier, Dr. Joe, a lot of our clients have a lot of shame, and we can, as social workers, we can try and reframe that conversation and to use motivational skills, interviewing skills to, really reframe the conversation in general, and be able to give that insight also to the medical insight providers, right? As we're taking a whole psychosocial assessment of the client. But I think it really is the social workers bringing in our unique skills, and then expanding on the conversations that the client is having.
Great, thank you so much. In the chat, we answered one of the questions, but another one came earlier in the week. This individual wanted to build more shelters for women suffering from domestic violence that actually allow family pets to be housed as well. This will enable more women to leave these types of situations, and both humans and animals who usually also get abused to recover and heal. How would I start a nonprofit? Would I need to start a nonprofit, and does One Health provide any help? Katie, do you want to answer that?
Yes, people get very excited about One Health, and that kind of speaks to some of the things that my colleagues were talking about before, where you have to find that person in the organizations that you're reaching out to that sees that and feels that as well, and has seen the power of the bond, and like knows that it is an important way that they can connect with and advocate for the folks that they're serving. I think that's what you were going for with that.
How about the toolkit?
Oh, all right, Vickie, I can talk about the toolkit. I think, it's great to be able to have sort of the structure that the toolkit can give you as a starting point to be able to take to organizations that you are interested with connecting with, to say, here's a plan that we can start to use, as well as, inviting them in to participate, come to one of our meetings. So we're going to do a kind of a meetup tomorrow for folks who are part of the conference, but then we also hold these quarterly meetings, and we have folks from our teams as well as pilot sites, if they are interested, kind of joining us. And it's a chance for us to just talk about the challenges that we're facing, do some networking, and troubleshooting, and try to get people's support as they're going through this process of setting up integrated care clinics. And we really love the idea of supporting people through this process and trying to make this happen for other communities.
Great. Thank you so much to this panel of presenters. There are some links there and emails if anyone wants to connect with any individual, ask specific questions. So thank you all for being here today, and we hope you'll join us tomorrow, and have a great rest of the conference.